We have heard repeatedly, including today, a favorite Liberal buzzword, partnership, working in partnership with First Nations. Well, I want to bring up Tetaskwayak Cree Nation, which is also in our region. They've struggled without clean drinking water for years, yet ISC, Indigenous Services Canada, wasn't even testing their water for the contaminants that were making people sick, forcing the First Nation to pay out of pocket for the work that ISC refused to do. Due to Canada's failures, they launched a class action lawsuit and have spoken about their fear of government reprisals for doing this. They're now taking their complaint to the UN, and I'm proud to support their efforts in doing so, but it didn't need to come to this. When asked about these failures, a spokesperson for ISC said the following, quote, Indigenous Services Canada has supported the community in the repairs and upgrades to their water treatment centre to ensure water quality continues to meet approved guidelines, unquote. The water that makes them sick continues to meet approved guidelines. This type of disrespect is far too common. In a meeting between ISC and Tetaskwayak Cree Nation in their community, an ISC official took a sip of water to demonstrate that the water was clean, seemingly ignoring the many communities members that had rashes or were otherwise sick. Does water you won't test properly that we know makes people sick continue to meet approved guidelines? And if yes, why is ISC maintaining that these guidelines are accurate? And what good do they serve outside of public perception? We know that the First Nation has been clear the water makes them sick. Why is ISC continuing this charade?
You raised a question in your last intervention around sort of whether or not we would penalize people who are taking legal action. I would say that categorically, no, we would not. We respect the right of Indigenous groups to take the decisions that they need to take for their communities. In terms of the water, the guidelines that we have are based on science, and we want to work in lockstep with communities. And in situations where people feel the water is unsafe, not only will we do the testing, but we will also work with our environmental health officers and look at what we can do. If there are things happening in the community that require health intervention, it becomes also not just a water issue, it becomes the health supports for that community. And we would continue to provide that and be based on science for the guidelines, but also a recognition of if something is happening, we want to work in partnership with leadership to address that.
Well, I would urge you to do so. I mean, something is happening, and the First Nation has made clear going to court is not their number one choice. What they want is clean water now, and let's be honest, Canada is able to deliver that. Political will is what we need to see.